West Virginia law requires every student entering 7th and 12th grades to receive certain vaccinations. June is West Virginia Adolescent Immunization Month. It's time when health advocates are pushing many students to get their vaccinations. Sarah Lou has more in this report.
You don't have to twist these students' arms for them to get the point about staying healthy.
Vaccinations, they save lives every day, and it's important to prevent the disease instead of treat it while you have it.
Officials with the West Virginia Department of Health and Human Resources and Cabin Creek Health Systems teamed up last June to spread the word that parents need to check their children's immunization status now, before that last-minute crush of back-to-school exams at the doctor's office. It's something the director at this school-based clinic at Riverside High in Kanawha County is passionate about.
One of the things that's really exciting in healthcare today is that preventative healthcare is really moving to the forefront. It used to be a lot of, you're sick, okay, let's go to the doctor and get it taken care of. And now the focus is shifting to being able to help prevent people from being sick to begin with, and vaccines are just a tremendous part of that.
And it's a message that now sticks with these students.
I thought it was just like a regular shot that everyone gets, because sometimes you go to the doctor and you just get these random shots. But now that I know it's very important to get the vaccination.
For the State of Health, I'm Sarah Lou.
Joining us to talk about why these shots are so important is Dr. Courtney Evans, a pediatrician with Kid Care Pediatrics in Charleston. Dr. Evans, thank you for being here.
That's a pleasure to be here.
Can you tell us a little bit about what vaccines are recommended for adolescents?
There are several that are recommended. What most parents ask about, specifically the ones required for 7th and 12th grade entry. 7th grade entry includes tetanus and meningitis vaccine. This is the meningitis 4 vaccine that protects against 4 types of meningitis. And the one for 12th grade is a booster dose of the 1 meningitis vaccine that they had entering the 7th grade. But those are the ones that the parents always come to the office ready to get the child enrolled in school for the fall.
Now, why is that important? I know sometimes everyone doesn't really understand why those particular, the pertussis, the meningitis vaccine, why is that critical for this age group?
Well, it's very critical. The pertussis, for example, in teenagers, healthy young people, it's just a chronic cough. But if you spread this to the elderly, we all have grandparents, we all have nieces, nephews, cousins, infants, this illness could kill them, no pun intended. And so it's very important to protect them against that. The meningitis is important. It is spread through droplets, bacteria that lives in people's nose, mouth, hugging, kissing, coughing, even touching your face and shaking someone's hand. This is scary because the people who carry these certain types of bacteria, it doesn't affect them, and they have no symptoms. They're not walking around with a rash. They don't have cold symptoms. They're not a booger face. You get near them, and you could be at risk for death. I mean, meningitis could kill you. And it's very scary, and it's vaccine preventable.
Now, we've had people ask us this question. It comes up a lot as a healthcare provider myself. Well, okay, if I'm vaccinated against bacterial meningitis, why have there been reported cases?
That's a very good question. Okay, so I had just mentioned that there was the meningitis vaccine that's required for 7th and 12th grades. That protects 4 different types of bacteria, C-A-Y-W. These are different letters. There were a couple of recent strains that were type B, which is not required for school, but there are vaccines for that as well. And you could talk to your pediatrician, the health department, to see who can help protect you against meningitis B.
So that's a very good point, I think. We talk about the difference between required and recommended.
Right.
And it's always good to go to your healthcare provider and have these discussions because, I think there's a misconception out there that sometimes a vaccine protects us from everything when there are so many different strains of things that are out there.
Sure.
That certainly can cause significant damage, as you point out, even leading up to death. What happens when a person waits till the last minute? School's getting ready to start, last minute, still need their immunization.
Well, school aside, it's important to protect yourself, whether you're going to school or not. The longer you're unvaccinated, you're at risk as well as those that are around you. Second, you receive your vaccines. They're not in vending machines. You go to a healthcare clinic. Pediatrics, speaking of it as a sport, we have seasons as well. Winter is primary, pediatrics is primarily a winter sport.
Right.
Then we are very busy this season as well. We have kindergarten roundup, so we have all the children that come in and have to have their health screenings and their vaccines prior to kindergarten. We have sports physical season, so remember for the following year, most of those have to have their health assessments by June the 1st or around June the 1st. So definitely, earlier the better.
Right. Now, just to change the subject a little bit, I know that we have a vaccine for adolescents that helps prevent cancer.
Yes.
Let's talk about that vaccine. It's not required, recommended. I think it's important that our viewers understand.
Yes, it is. It is recommended. It's not required by the school, but again, the longer you go without vaccination, you yourself are at risk or at risk for spreading it. So you're talking about the HPV or human papillomavirus vaccine. Protects against 9 different types of that virus. This is a virus that can cause cervical cancer, penile cancers, genital warts. This is more than 80% of adults have some kind of exposure to this. Most of us can relate. We have a friend or a family member or someone we know that's had an abnormal pap smear or some sort of procedure or follow-up related to this virus, and it prevents cancer. I mean, I feel like if we had a vaccine that helped prevent lung cancer or colon cancer, people would be like beating the doors down. But this actually prevents cancer. West Virginia has one of the highest, if not the highest rates in the nation of cervical cancer associated with human papillomavirus. So absolutely, it is highly recommended in this age group.
Now, I know that you talked about the fact that we have a high incidence of cervical cancer. We see that in public health. That's a very specific statistic that's true. What about our percentage of vaccinations? Do you have any idea how well we're doing in that category?
I think the HPV vaccine is it's the 3-dose series, and it should be completed within 6 months. So you get dose number 1, 2 months later you get dose number 2, and 4 months after that or 6 months after the first one you receive dose number 3. If I'm not mistaken, and I would have to review the statistics, I think it's less than 75% complete all 3 courses in the recommended time schedule.
And if you don't complete the recommended course in the time schedule, then it's potentially starting all over again to be able to actually ensure that you have been immunized appropriately.
Yes,
does that immunization pose any greater risk than any other immunization that's out there?
Every vaccine, there are risks to everything, just like I can't guarantee you won't be in a car accident today on your way home.
Right.
There are risks to everything, but please, if you're going to look about risk, go to a real medical website. There's a vaccine adverse event record system that you can go. The majority of people have just pain at the injection site and the anxiety related to
Right.
getting the vaccine. There are risks to everything, but the benefits, I mean, just prevents cancer is just huge, huge.
Now, we speak to a lot of healthcare providers about that, and I think that really is something that viewers need to know.
Yes.
Regards to the vaccine, whether you're talking about adolescent children, generally speaking, the benefit outweighs the risk. Please talk to your healthcare provider.
Right.
Please make sure you have the information that you need so you can make an informed decision about what's best for your child. And in this particular case, your adolescent child, who may not want to go to the doctor because they don't feel like they need to get a shot anymore,
Right.
but it is important.
It's very important, and I think who you reference is also very important. If I had car trouble, I would go to the mechanic. So if you have a health-related question, please speak to your provider. It's not up to the mechanic to give you, information
Right.
that's healthcare based. So just speak to the appropriate resource.
I love the analogy. I think it's a good one.
Yeah.
Thank you so much. I
Thank you.
appreciate it. That's all the time we have for today's show. Remember, you can always follow us on Facebook, Twitter, and our website. I'm Karen Bowling, Cabinet Secretary for the West Virginia Department of Health and Human Resources. Thank you for watching The State of Health.